All right. My connection to Corey is I'm in Lower Kentucky. I work out of the same office that Jesse does. A little bit about my background, guys, is a soccer guy for life. So I had the opportunity to have a good youth sports time in sports and then played collegiate, got to go overseas, played a little bit of USL soccer, and then jumped right into coaching the day they took me to go home. I've been working on developing programming for the story arc of 8 to 18, and Corey and I have partnered to train, started an academy program in North Kentucky for 8-year-olds going through 18. We really focus on my background as I have an undergrad in exercise physiology and master's in biomechanics. I have a history running health clubs. Been in this space for over 20 years. And Corey and I partnered. And then in 2012, I diversified a little bit what I was doing. I left the health club in 2011, went out on my own, where I met Corey. And then we started doing some insurance. In 2012 is where my partner Brian connected. And we opened our own agency, Harders Grove Benefits, in 2019. So we're a regional brokerage. Our headquarters is in Florida, where Brian and Sabina sit. So they manage a lot of that area, Florida, Georgia, so on. And then I'm in Northern Kentucky, running Kentucky, Ohio, Indiana, down to Tennessee. So that's kind of a little bit about us. We're a boutique agency, so we really work to focus on meeting where groups are. And so what we did was put together some options for you guys. Now, with Corey's involvement, we're taking advantage of the fact that you guys are W-2 employees. So Corey gives everyone a W-2, which holds all your taxes on your W-2 and helps you do the payment to the tax man, right? So utilizing your paycheck to purchase benefits is a way to get group rates. So you guys, Corey has a payroll company that runs payroll, and you can use your paycheck to buy your benefits, and that allows you to lower your income before your taxes are applied. So that's one savings, is that you're going to be lowering your tax obligation by buying your benefits with your paycheck, and that's a great strategy for employees and employers. The other aspect is when you go through a business to get your benefits, you get group rates. So you get better rates than you can on your own out on the street. So there's a couple benefits, one with tax and one with rates and program design. So we've got a proposal we're going to run through visually here on the screen. We will be emailing this out to everyone for review. And when I email that out, it will have a Calendly link tied to my email. And you can then reach out to book appointments with us digitally. Those are 30-minute appointments. It is through Zoom, just like this is. So we can connect on the screen, review the benefits, and help you guys obtain coverage for the programs that we're going to educate you on today. So I'm going to go ahead and pull that up and just kind of run through this. So can you guys see that on the screen? Okay. All right. So the first one, we had one guy in Kentucky who's not here, Jesse. And because Kentucky is a little bit different state than the rest of them, there's a specific plan that he can take advantage of that's going to be a little bit different on the medical side than everybody else. Since he's not here, we're going to skip over that. I'll get with him individually and show him that. But the plan designed that a medical option that we have for everyone to take advantage of is through a carrier called Philadelphia America Life Insurance Company. They have a very modern healthcare approach. So most people have been conditioned to understand healthcare in a very specific way. Been driven by the government and what they do with their Affordable Care Act. And this carrier has put together a very modern plan. Now, this plan is designed for people who are a little healthier. So this demographic tends to fit that need a little bit better. And it's set up in a little bit different way in terms of trying to contain costs. Because at the end of the day, insurance must be affordable to purchase, but also affordable to use. And what we've seen in the landscape of healthcare is that it's become very tough to buy it and even harder to use it. Meaning that your deductibles and your co-insurances and your out-of-pocket maxes of the last 5 to 10 years have come extremely high to where, if you have a $6,000 to $8,000 deductible, you might not be able to even use the insurance if you purchased it. And so that's where this plan has no copays and no deductibles, offering first dollar benefit. So that's a huge win. The premiums on this plan are going to be much lower than you see on the exchange, minus getting a subsidy. So for a lot of people, it could be a fit. It's also guaranteed renewable. So once you are approved in the plan, you do not have to prove your health again. You're guaranteed to renew this policy, and that can go all the way up to age 65. The rate increases on this policy is based upon your age, not your usage. So let's say you had a light year, didn't use it, you're still getting a slight rate increase as you age. Let's say you had a really heavy year and used it a ton. Your rate increase will be tied to your age only. And those increases are going up slower than the national average. So you will have rates go up each year, but it's not going to be as fast as we've been seeing on the traditional side. The way the plan is set up, it's set up indemnified, meaning that they are going to list exactly what they're going to pay out per event. So it's a little different than your typical insurance where they say you got to pay into your deductible, you have to hit this out-of-pocket max, and then we'll cover the bill. This is coming in and saying you get first dollar benefit for these procedures. So just going down to a doctor's visit, and we use unit 2 as our standard unit. It's the best bang for the buck on the plan. So I'm on a plan like this. I have a lot of people in my networking area that are on plans like this. And so if you go to the doctor's office, they pay $120 towards the physician visit. If it's a specialty, they pay $150. If you're going to get an MRI, PET, CAT scans, it's $500 per day. X-rays are $160 per day. So it's going to list what the plan is going to pay out for that event. So you know what you got to utilize for a benefit. Okay. And again, we'll send this out for you to review. I'm not going to read every single one, but what makes it really interesting is the First Health Network. So it's a national unrestricted network that this plan is on. And it's very easy to shop the plan to make sure your area has options. So this link right here will take you to where you shop it. And if you're utilizing the First Health Network, they have negotiated a 40% discount on services from the doctors or the facility side. So if I go to my doctors and he's in the First Health Network, I get a 40% discount on services, and my $120 is applied to that coverage. So in my instance, to see a doctor would be with the discount is $90. I have a $120 benefit that is applied by the insurance carrier to pay the bill. And then I actually get the difference sent to me in the form of a check of $30. I take that $30 and I put it in my bank account. So we have a lot of times where our clients, our customers, will get a check back in the mail after they use the benefit. That's not income from an employer. That's over indemnifying yourself, which is a non-taxable event, and you can put that into your account, and that's to protect time off work and so off. If the service was more expensive than the benefits, you would owe some out of pockets. Now, when you start to look at this coverage, even if you had out of pockets, you have to apply the fact that you don't have to meet a deductible. So for many people, they're still going to save quite a bit of money because they're not meeting a deductible before they get their benefits. So a lot of people, when we consult with you, we're going to be asking you, what kind of coverage did you have? What are you paying? How does the plan design currently work? We'll look at the monthly cost of your benefit, what your out-of-pockets look like, and what your deductible is, and we'll financially compare it to this and be able to show you if it makes sense financially for you to move into this type of insurance. It does have no cost telemedicine tied to it. They have some prescription savings to it as well. So it does allow for some good features in the plan. So that's going to be the medical option that we recommend, that we can facilitate across all the different states that you guys are in. So it always gets a little tricky with medical when you have a lot of different states. So this is an option that you can get it through the business address under one billing. Okay. So any questions there with that? All right, I'll keep moving there. Humana is a Kentucky company, and but a nationally known company, and they have a great dental, vision, and life insurance option. So just going to walk through the dental option for you guys. If out of all the employees we get 5 enrolled, there's no waiting periods at all to use your coverage. If we don't have at least 5 enroll, there will be waiting periods in year 1. So that's our participation level. It's a PPO plan. What PPO means is that there's coverage in the Humana network and coverage out of the Humana network. So you can choose your provider. Humana has a very large print, so we found that it's pretty easy to stay inside network. But if you were outside, you do have coverage. So inside your network, you have 100% coverage for your type 1 or your cleanings, your preventative. Those are that benefit does include periodontal cleanings, which is your deep cleaning. So everything listed down here with my cursor are things that are included. We included a $1,500 ortho benefit for the adult and the child. Endodontics is included in your basic services and composite fillings. You get 3 cleanings a year on the plan on the calendar year. If you need type 1 procedures, which would be kind of like a cap, it's at 80% coverage. If you're in network, there's still 50% if you're out. And then your major services, which would be like a root canal, is covered at 50%, both in and out of coverage. But what makes this plan really enticing is this annual max. You see $1 million. What that means is there's no annual max. And from our perspective, if we've talked to anyone that had some major dental work done, they hit their annual max pretty quick. Most people are used to seeing $1,000 max, and that runs out and they're out of pocket for the rest. So this allows you to have that coverage at 50% up to any number that you see back from the dentist. So really attractive policy. Rates, if it's employee only, this is a monthly rate. We would break it down to your paycheck for you when we meet. And then you can include dependents if you choose to add them to the coverage. Okay, so that's the dental policy. The vision plan is a 200 plan. So that gives you the opportunity to get your exam with a $0 copay, materials, $0 copay, and then it gives you an allowance of $200 for frames and or lenses at $200 per calendar year. And then we did include retinal imaging in the benefits. So as Sabina was telling us earlier, that is going to be upwards of $100 charge if you don't have that coverage. And they do that retinal imaging, that would be included in your policy. And again, the rates are $10 for employee only per month. Okay. So there's the vision, and you don't have to do both. It's a la carte. You can choose one or the other or both. And then Corey, the fearless leader that you have, is going to be covering a employer paid life insurance on each employee. So it will include a $25,000 face amount. It includes AD&D, that's accidental death and dismemberment. So if someone lost an arm on a motorcycle, there's a payout. And that's covered by your employer. That's a working term policy. So while you're under his W-2, you have the coverage. If you leave him, you lose it. Okay, so that's while you're with him, he's covering you. Heaven forbid that there was a loss of life, that would go to your beneficiary for that. And then there is the opportunity to buy up life insurance if you choose to purchase your own. And if you purchase this is portable, meaning that you could take it with you wherever you landed in your career, and you could pay for it on a direct basis. You can choose a minimum of adding 25,000 to the working term, and you can go all the way up to $100,000. And guaranteed issue is 50,000. So if you're 50,000, you do not have to do any underwriting questions. You want it, you get it. If you want to go up over 50, there's some questions you answer about your health to get those. It's hard to understand the rate chart, but we can decipher this for you guys when we meet. But let's say you're 35 years old, you can get $100,000 for $13 a month. Okay, so some very compelling rates. When you go to the market, this is very compelling on the rate side. And again, this is a portable program that you own, even though you're getting it at work. Okay. All right. So accident insurance. You guys watch kids run around all day and you see what? Accidental injuries. So I have 5 boys. Brian's got 3 kids. Sabina's got kids. We all have accident insurance. It's a no-brainer for us. We know that we're going to win over the course of our kids' lifespan. This also covers on or off the job. It's a 24-hour. So if you were going to purchase this on yourself, you can include your dependents if you have those. And what you're protecting is the fact that if you have an injury and you need to seek treatment, this carrier is going to pay a benefit to you directly outside of what your medical does. So when you think about insurance, people go, well, I have health care. If something bad happens to me, I'm good. That gets a lot of people in trouble because they're not protecting the out-of-pockets associated with a medical plan. They're not protecting time away from work. So these benefits are paid to you directly versus the health care that would pay the carrier. And you can protect yourself. There's 2 levels of coverage here. And again, you can add spouse or dependents. And these benefits that are listed will be paid to you directly. Again, this is not income from an employer. So this is indemnifying yourself against a medical bill. There is a claim form that we provide you. So if you need to file this claim, let's say you break your arm, you're going to let us know that you had the claim, and we're going to provide you with a contact number, and we're going to work to get basically the billing from the hospital to show what they did for you. Fill out a claim form. We send that in. They're going to send you a check for the amounts that are listed. So, hospital admission, if you're admitted due to the injury, something severe, there's admission benefits. If heaven forbid you're put in the ICU, those benefits go up. Your initial treatment benefit just to be observed, there's benefits to walk through the door, whether you go to the urgent care, whether you go to the emergency room, whether you use a physician office, whether you actually use telemedicine. There's benefits to be paid to you directly. If you're, most people that go to the ER or in to see an injury are going to have an x-ray. There's benefits for x-ray and diagnostics. If you require therapy for the injury, there's going to be therapy benefits. You just have to prove you were at the therapist that day. You get the note, you send it in, they send you the check. So the biggest thing here is going into the injuries, right? So let's say you're training and we had a guy hurt his knee. So Corey knows that. So you have a knee injury. If it requires no surgery, it's in the first column. And if it's a surgical fix, it goes over into the larger column. So in that instance where we had a guy need surgery on his knee, he would receive the $3,600 check just from the injury itself. That probably would have gone a long way with the other benefits of protecting his loss during that time away from work, as well as medical bills. Okay. Going down, and again, there's a long list of benefits. We don't want to read things to you. You guys can read. But going down to the rates, this is set as monthly. Again, we can put it into your payroll, but you're looking at 7 to 11 bucks a month in coverage for an individual. And then if you do have dependents, you can add them to this coverage and protect those out of pockets due to the injury. Okay. The last component is the one that Corey was alluding to, the proactive health management plan. This is new to the market in terms of the concept. Not many people have heard of this. We've been doing it since 2018 when this was implemented. And this is for someone, you don't have to be on a medical plan to do this. This is a voluntary option, just like getting an accident policy. You don't have to have health care to have this. But it truly does have a lot of really cool benefits tied to it. So the first thing is just kind of walking through the benefit. There's 3 ways that this policy pays out, and we'll go into this more depth on the individual level, but just to prep it, this is a hospital indemnity plan. So what that means is if you were hospitalized due to an injury or a sickness, and hospitalization means you get a bracelet put on you. It's going to pay $100 a day for up to 5 days a year on that. And it has health screening benefits. So if you're going to get a health screen for your wellness throughout the year, it will pay a $50 benefit up to 5 times for you to get a health screen for your checkup. The biggest component is that once enrolled in the plan, it's going to provide you an opportunity to get a claim payment from the insurance carrier of $625 put on your paycheck once a month. And this is going to offset the cost of the plan and actually increase your spendable income you get to take home for most of the employees on the call. So a way to take advantage of some tax savings that allow you to increase your take-home pay at the end of the day. Now, once you're enrolled in the plan, the enrollment for the plan is done with a simple HRA, which I'll show later here. But once you're enrolled in this plan, all the benefits I'm going to explain to you are given, or you have access to a 0 copay. So the first one is family telemedicine. So whether you have a medical plan or not through us, you can enroll in this plan and get 0 copay telemedicine for you and your family. That's 24/7 access to a doctor digitally. They can prescribe medications, and you guys have an access point. I get sick 2 to 3 times a year because I hang out with all these snotty-nosed kids at night in a facility. They get me sick 2 to 3 times a year, and I need a freaking prescription. I don't want to go to the doctor's office anymore. I get on telemedicine, get that done, go pick, they send my prescription to the local pharmacy. I go pick up my prescription and I'm done. So it's ease of usage and no cost. The next is family behavioral health. Since COVID-19, we've seen a lot of people wanting to get access to a therapist, not only for the parents that are enrolling these plans, but also for maybe their kids that need the opportunity to get access. Therapy can be very expensive if you're talking to somebody. It's a lot of out-of-pocket expense. There's not a lot of help on these insurance policies for that. And there's a lot of limits on how many times that they'll pay out in a calendar year. So a lot of employees that we talk to are paying out of pocket for therapy or not being able to get access to them enough to make a dent. This allows you to shop different therapists, to find the one that you like, book on their calendar up to once a week. So you can meet with a therapist on a weekly basis. That therapist, if deemed necessary, can triage you up to a psychologist or psychiatrist, and you can meet with that professional once a month at no cost. So a high access point for that benefit. And that's actually turned into the #1 asked benefit at work right now for companies that offer benefits. So we see that as a huge win. And you don't know, again, what anyone's situation is, but that's for the individual or the dependents in their family. Also, you get access to biometrics once a year at no copay. So all you do is utilize your one app to run all this. You just click that you want to do your biometrics. They're going to send you some information and a voucher to go to a local lab. It's at no cost. You can go through and get your blood, your cholesterol, your sugar, all that done at no cost. And then they're going to have a health coach that when your results come back to you, will reach out and say, hey, do you want to review this information with us and let us make recommendations from a health coach based upon what those numbers are. So not only getting you guys access to go and getting your biometrics done on an annual basis, which is as we know, Corey, good for health and weight, but also a health coach that's going to sit down and explain what this is saying to you and be able to make recommendations. Another really cool component is a DNA screening. You can order the kit from your app. They're going to send a package to your home, and you use a cotton swab in your cheek and send it back postage free, and you'll get a report. And they don't do your family ancestry, and they don't do any chronic ailments or illnesses. All they're going to check is food and exercise. So they're going to check, what kind of exercise gene you have and how you should be targeting the correct exercise for you. I've done mine, and I have the sprinter gene. So does my partner Brian. He was a wrestler, and for us to get a maximum result to exercise, we should be focusing on high end sprinting and weight training. It goes into the very explicit how we should be exercising. It also goes through every type of food, your carbohydrates, your proteins, and tells you in ranked order what type of food is better for your genes. It'll also go through your Achilles gene and tell you what susceptibility you have to injury. So if you're more breaks or sprains, it'll go through any malnourishment. So both Brian and I have a B6 vitamin deficiency. And so by 4 o'clock, we're not focused and we're moody and we're yelling at everybody. Now we have an excuse for that behavior. And so we have committed to a B6 vitamin to try to behave from our 4 to 5 meetings. So really cool information. Again, you have a health coach that'll meet with you once you get the report and review all the information and give you recommendations and break it down. So a lot of support. Every Tuesday, every Thursday, once you're enrolled, you're going to have contact from the carrier. They send you a text every Tuesday to remind you of all these benefits because people just get busy and they can't remember this stuff. So they want to keep it in front of you. And every Thursday, you get an email with all this information that you have in front of you. So just constant communication effectively. So you guys remember your telemedicine and all that. So we don't have you guys not utilizing it correctly. Embedded in those reminders is a health article. So it's on an HTTP link. So you can click on it on your cell phone or on your computer. It's going to take you into that month's health article from a health coach. We say that because to be in this plan, there has to be one monthly activity to stay enrolled. And if you click that link 1 out of 8 tries for the month and view your article, you have actually done a participatory function to stay enrolled in the plan. We call that the Staples Easy button if you watch commercials anymore. Obviously for some employees that don't have immediate needs to get in front of a doctor or a therapist or do some of this stuff, it allows you to stay enrolled in the plan. The articles are very informative. We have an accounting firm that we work with, and the owner kind of poo-pooed on the idea of doing this, and now he's one of the biggest bloggers, and it is really interesting information. So once a month, you need to do that link to stay enrolled in the plan. If you miss 2 months throughout the year, you do get removed from the plan, and everything would go back to the way it was before you started. And then disease management. If they identify that you have a chronic illness, you're not removed from the program, but you're going to be provided with support. So there's a health coach that is part of the American Health Data Institute. It's the largest database for the workingly chronically ill in the United States. And they have coaches inside of that organization that if you have diabetes or COPD or any of these chronic ailments, they're going to be reaching out to the participants and educating you on the minimal level of care for your chronic illness and trying to motivate you to do the things you're supposed to do. One of the stories behind this is that right now, 83% of people in the United States that are working that have a chronic ailment are not meeting the minimal level of care, which is why everyone's health care is getting out of control. We're just not doing the things we're supposed to be doing. So this plan is incentivizing them. And if they do those things, they get a participatory event in the plan, which keeps them enrolled and keeps their paycheck a little higher. So the idea is to financially incentivize people to do those types of things. If you do any type of immunization, you self-report that on your app. They take your word. It's the honor system, and that's an activity for your month. And the last is access to a diet and nutritional counselor. So if you want to meet with a nutritionist or a diet counselor and get on a meal plan and work on your intake, you can do that at no copay, and you can meet with them digitally. So what we've kind of see really works well with a lot of our groups that do this is they do their DNA tests and their biometrics, and they get some science behind themselves, and then they reach out to a diet and nutritional counselor with that information, and they can actually put something together for you that actually could make sense and obviously get you on a path towards better health. And that's the goal, right? To minimize chronic uh, illnesses from occurring and to provide healthier employees. That helps everyone's insurance moving forward. That's the main purpose of the plan. Again, with this plan, most of you, when we did your quotes, will see a slight increase in your take home pay if you choose to enroll. We find that it makes it easy to say yes to trying the plan out. And then we're hoping that once you're in it, you appreciate the communication, the way they run the plan and the benefits tied to that plan. So when you click for an individual meeting, we'll have your individual setup. We'll be able to show your paycheck before and your paycheck after and explain how that works to you. And then if you choose to enroll, you fill out an HRA. I'm actually going to show that here. That up real fast. Boom. The health risk assessment is right here. It literally takes 2 minutes to fill out. You're going to put your date, your company name, your language, first, last name, address, city, state, zip, department, blah, blah, position, gender, email, date of birth, contact information, height, weight, last time you saw a doctor, and then check all that applies. And so it goes through a list of things that are checking for. And the only reason they want to know this is if you have this stuff going on, they're looking to provide and hone in support for you. So if you have an anxiety issue, I have one every Monday morning at 8 o'clock. I can get support to try to settle myself down. Okay. So they're looking to not get you out of this program. They're looking to provide the support needed for whatever it is that you're dealing with. Because again, we want to provide resources for you guys to have better health. Okay. Brian, you have anything to add to that? You're on mute.
Trying to keep background noise down. No, I mean, it's just a program, gang, that, you guys are getting brought to you that we take to large organizations, right? So because of the connection and the relationship, we're able to ask our partner carriers to help us out and bring this all to you guys as well.
Sabina, any addition to that?
Oh, you did a great job.
Oh man, I never hear that. Any
Being
questions from the
recorded.
group? We covered a lot. Again, we recorded this. We'll share this, email this recording to you, Corey to share, and then I'm going to send out the proposal I put together out. I will also have a Calendly link where you can book appointments with us to look at the plans. Really, over the next 15 days is our focus time to be able to get people looking at this and figuring it all out.
You have a question. The last part you went over.
Yep.
This is Brad, by the way.
Hey, Brad. I know you. I've had dinner with you.
Yes, several times. But the last, is that just like, can my spouse do that as well, or is it just for the employee there?
Yeah, employee only because it affects your paycheck. So it's just going to affect you as the employee, but your family would get access to the telemedicine. Your family would get access to the behavior health. You're the only one that can do the DNA test and the biometric on it. There is embedded in that as well as some smart shopping tools, and I forgot to mention that. On the PH&P app, if you have prescriptions you take, you can actually put your zip code and the prescription in, and it's going to pull up every pharmacy in your area and show what they actually charge. And then embedded in it is the coupon. They utilize Clever RX. Everyone's seen Good RX on TV. Clever RX has more prescriptions. That's why they utilize them. And if there's a coupon code that's available, you can generate it through your app and go to that pharmacy. You would be kind of blown away by how many times you can use a coupon code and not even need your insurance to get your prescriptions. And that's a huge win. So that's all on your app. And we have a lot of people utilizing. I'll tell a story about a lady that was getting her prescription. It was a specialty brand prescription, and she was going to CVS, and we shopped it on that app. And there was a coupon code to go to Walmart, and it was going to cost her $4 instead of like $100 a month. So she was like, "Sign me up! I want to go use that." So that was a good one. There's also a transparency tool for facilities. So let's say Corey and Brad get in a fight at work, and Brad throws Corey through the wall, and he needs an MRI on his shoulder. He can put that into his transparency tool, and it's going to show all the facilities in his area that offer an MRI and what they're charging. And again, you'd be blown away. A facility A on the right side of the road is going to be 3,000, and facility B on the left side of the road 500. And so Corey's incentivized to look on the app and save $2,500 and go to the left. So that's part of the plan as well. So obviously, Brad, your family, if you have medical needs, prescriptions, it's just a resource. We find that one of the problems with healthcare is that the powers that be are keeping the consumers uneducated. You know, most people just go wherever their doctor that they talk to tells them to go. And if you research it, you might find that's the most expensive place on the block. I'm not saying they're unethical, but a lot of times behind the scenes, they get a kickback if they go over that facility. So you can check those things and become a more educated consumer. Again, to us, we want to keep money in your bank account. We don't want to risk your assets, but we also don't want to make you insurance poor. So anything we can provide you guys to be able to research a little bit, take 5 minutes out of your day and look this stuff up, you're going to save some dollars in your bank account and make a couple better decisions. That's a big deal across the way for your fiscal health. Did I answer your question, Brad?
Yes.
I didn't allow you to throw Corey through the wall on my answer. I thought you might like that.
That was really enjoyable. So I appreciate that. No, thank you.
Anytime.
We're not at the office right now together, so he's probably really happy that I can't throw him through the wall.
He's puffing up his chest that you're home.
No.
All right, guys. Well, like I said, we'll follow this up with an email. Corey, you got anything to add?
Yeah, I mean, if the rest of the crew doesn't have any like specific questions, I just want to make sure that I was taking some notes. Like, to reiterate, guys, and Jeremy, if I'm speaking out of turn, let me know. But this is like a boutique insurance firm, and so if some of the suggestions that he provided don't specifically match you or your family's needs, set up a time on Calendly and say, hey, this is what I'm trying to find. How can you get what I need, and how much is it going to cost? Do that. Just and to reiterate, these are just options and suggestions. There's not one thing on this plan that it's mandatory. But if we were listening closely, it sounds like there's several plans. I think that all of us would at least be wise to look into. And so kind of with those points being said, Jeremy, you referenced like a 15-day window, but can you kind of reiterate like what the process looks like for us, what we need to do to make sure that we go through the necessary steps to take advantage of, getting involved in these plans?
Yeah, so the insurance carriers, obviously with a group plan, they want to have an effective date. And so we work towards a specific effective date. Where we work towards all of it is a 45-day window, but to have everything done 15 days prior to the month. So, with these plans, we're moving towards a 4/1 effective date to get plans up and running and have everything figured out. I always like to have things figured out early. If I say, hey, we have to be done by 3:15, I'm going to get calls on 3:16. So I always say, hey, between now and March, let's meet. If you're interested in meeting, book an appointment. Let's get all this figured out so that, Corey's busy. Look at his hat hair. I mean, how many different hats go on that head to get hair like that? I don't know.
No, that's natural.
We're all busy. We're all trying to help each other. But if we can get our appointments booked in the next 15 days, let us consult with you. Let us figure out what's a fit, if it is or isn't. Go through that. Then we have plenty of time to get the rigmarole done and have a live plans ready to go on 4/1 effective. And anything you're currently having in place, if you want to discontinue that coverage for any reason, we know, okay, 4/1, we're going to turn that faucet off and turn this one on. So that's kind of, great question, Corey. That's our runway, is to go live on 4/1, and we have to really be done by 3/15 to do that. So between now and the end of the month, we'd love to have our meetings and then get everything set up.
And then that life insurance, the quote unquote company provided life insurance policy, that we don't need to do anything, guys. It's once it's all processed.
Yep.
I guess it's a $25,000 benefit if, God forbid, anything happening to you guys. Your families would at least have that to help with that unfortunate circumstance situation. But Jeremy, the other stuff, like, are any of the policies, so like that dental plan, you were mentioning that all has to be put in place. Are there any participation limits that we need to be aware of, like the dental?
No,
We got to
so
get 5 on
with
board,
dental, 5 enrolled is kind of the goal with dental because of the waiting periods on the plan for the group. If we can get 5 people enrolled, there's no waiting periods. The vision is the vision. The PHMP, we got an approval to bring this in to a smaller group because of the relationship Corey has with us. We typically don't start that till 20 enrolled. Obviously we'd like to consult with everybody on that because it could be very financially advantageous for you guys to look at that, but we have it set up where it's being offered to your group no matter what the participation is. And then with the healthcare offering through New Era, they like to see at least 3 people enrolled to do a group account. So that's an option there to look at. We can enroll people 1, 2, doesn't really matter, doesn't change the rates, but to do it through the group, meaning that they would do a bill to you, Corey, that we could do it out of their employees' paychecks. We would need 3 to get enrolled in that to do that, or it just goes to the individuals. They pay the bill themselves, and then they can do your reimbursement amount. So those are just the participation, how it breaks down. But I think the biggest thing is just getting people booked with us and let us go through the numbers with them. And again, when you meet with us, bring us what you have, and we want to know what you have. We want to know what the cost of what you have is, because that's your level of understanding is what you have in place. So if I talk to 10 different people, I have 10 different understandings. I need to understand what you're looking at, what your cost is, what you're used to. Our role is to show you a better version of that at less cost.
and then guys, just in case it wasn't clear, that proactive health medical plan. I don't know if I'm saying that correctly. That, like, he ran the numbers based off of he was sent like you guys payroll, like basically your salary and your benefits on a blind sort of document, and he ran it and came back with, of the 11 employees or whatever that we have, there's only like two people where, based on their situation, they actually had to come out of pocket. The rest were actually going to make money on the sort of end, like the end result was they were going to see anywhere from like $10 to $50 every 2 weeks back in their account, and they get all the benefits that are associated with PHMP. So at the very least, guys, if all the other stuff doesn't make any sense, worst case scenario, take advantage of the PHMP so that you get all the virtual health benefits. And like he was saying, it's designed to help. Like, the reason it's put in place, the government put it in place so that the citizenry of the country can maybe be healthier. And so the benefit and the reason that they're saying you have to just download the health thing is because they want to see that you're actively involved in trying to better your personal health. And so that's what keeps it active. That plan, I think all of us should look at and take advantage of. I know I'm going to, for my family. It's actually, I think I pay $100 a month to have like access to a doctor, and that's just for me. I think I'm going to be able to eliminate that myself, which is going to save me $1,200 plus the extra $500 or $600 that I'm going to see saved by getting payroll tax relief. So and I think the one thing before you said a meeting, I think everybody should set a meeting. I think this could be beneficial. Think about all the different insurance needs that you have. Use, like, Jeremy's kind of part of the family, so I trust 100% that he's going to find the best plans for us. And so like you put all your needs together, if you can find something that works for you, take advantage of it. And then he's able to utilize payroll to pay for some of this stuff, which would also have a benefit for us by, reducing our payroll tax burden. So,
Yeah, I mean, when you start to look at your expenses that you live by, besides your utilities and your monthly costs of bills, taxes and insurance, they're two thorns in people's side that will never be removed. Insurance, and this idea started back in 1978, where the government put the ability to lower your tax burden if you're buying benefits. They allow you to do that, and they're incentivizing you to do that. It's just most individuals don't take advantage of it because they don't know how to do it. So by Corey bringing benefits to work, you guys can take advantage of available tax savings to be able to purchase your benefits, as well as get group rated plans versus going out, to the individual market and just seeing what's available. And we sell individual stuff all the time. They're like, well, why aren't these benefits as good? I said, because you're not getting them at work. It's not as good on an individual basis that they are at work. So, yeah, so we'll email all this out. Courtney, she's got the hand
Sorry.
up. What's up?
I just want to clarify. So it was accidental insurance.
Yeah.
What's the difference between that and a short-term disability policy, or is that a different word for the same thing?
No, short-term disability is a paycheck insurance.
Yeah.
So it basically replaces the paycheck if you're out. Accident is just a lump sum payment for whatever was done when you had that injury.
Okay.
Yep.
Thank you.
You're welcome.
And then I just want to put my own plug because I was a wellness coordinator and then I worked as a health coach as a vendor. And this is better than company, just as a wellness program, considered as a wellness program, that last portion, I recommend everybody takes advantage of it because all you have to do is engage. That's so simple. And we get better benefits than companies with thousands of employees. So thank you guys for
Appreciate
putting
that.
this together.
Yeah,
Thank you, Corey.
this is a big benefit offering. We do this in companies that are very large, and because of Corey's relationship, we were able to bring this in here. So we're excited.
Yeah. Thank you.
Yep. All right, guys. Well, Corey, thanks for setting this up. And again, you'll have my email address. If you have questions that you didn't think of because you're like me, and then you go get off and go, oh, dang nabbit, I should have set an appointment. Set an appointment. Let me know your questions. We're here to help you guys. All right. All right, guys. Have a great day.